The potential benefits of taking the COVID-19 vaccine far outweigh the risks, making it an important tool in protecting our populations from this deadly virus. Depending on which vaccine you take and when, there are certain side effects that may occur due to changes within your body as it reacts to being immunized against the virus. Common side effects associated with taking a COVID-19 vaccine include symptoms such as soreness or swelling at the injection site, headache, muscle pain, fatigue, fever, and chills. These reactions typically last between 1 to 2 days and should not be cause for alarm. Serious allergic reactions to any vaccine are extremely rare and can be treated quickly with medications such as epinephrine if they do occur. If you experience any severe symptoms after receiving a vaccine, you should seek medical attention immediately. Although the COVID-19 vaccines have been studied extensively and approved for use by regulatory authorities, it is still important to know what other possible effects they may have. It is recommended that anyone who receives a COVID-19 vaccine discuss all possible risks with their healthcare provider prior to taking the vaccine. They can also provide guidance and advice on how to best manage any side effects that may occur following vaccination. The long-term efficacy of the vaccines in preventing serious illness or death due to COVID-19 has yet to be established, as they are still relatively new and are being monitored closely. As more data is gathered from real-world settings, it is anticipated that the efficacy of the vaccines will become more clear. Therefore, in order for the full benefit of vaccination to be realized, individuals must continue to follow public health measures such as wearing a mask and social distancing. While there are certain side effects associated with receiving any kind of vaccination, including fever, muscle aches, and fatigue, it is important to keep in mind that these symptoms typically resolve within a few days. Severe reactions to COVID-19 vaccines are very rare. However, if one experiences any concerning signs or symptoms after taking a dose of vaccine, they should seek medical attention right away. In addition to potential side effects, those who receive a COVID-19 vaccine will also benefit from the protection it provides against the virus itself. Clinical trials of various vaccines have found them to be safe and effective at preventing acute illness caused by the virus, though their exact efficacy may vary depending on a number of factors, including what type of vaccine is used and a person's age and underlying health conditions. While scientists are still working to learn more about the long-term effects of COVID-19 vaccination, there are some known benefits that can help protect individuals for months or even years after taking the vaccine. These include not only protection from getting sick with COVID-19 itself, but also from experiencing severe symptoms or requiring hospitalization if someone does become infected. Vaccination also offers protection to those who may be at high risk of more serious complications from COVID-19. For example, elderly individuals and those with pre-existing chronic medical conditions are more likely to experience severe symptoms if they become infected. Therefore, vaccination can provide them with extra protection against these potential risks. For people without any known underlying health conditions, the benefits of taking a COVID-19 vaccine extend beyond avoiding acute illness caused by the virus. Vaccines help build immunity by triggering an immune response in the body that will protect from future exposure to other infections or illnesses. This is called herd immunity and occurs when enough people have been vaccinated so that even those who are not protected themselves can benefit from the protection of those around them. The virus also has the potential to cause long-term effects, even in people who have already recovered from acute infection. Studies have found that many people with COVID-19 may suffer from lingering symptoms for weeks or months after their initial illness and may suffer from lung damage, heart damage, and other complications. Taking a vaccine could potentially reduce the risk of these long-term health conditions. While taking a COVID-19 vaccine is voluntary in most countries, it is important to note that receiving the vaccine can help protect not only your own health, but also the health of those around you. Vaccines are more effective when as many people as possible take them so that herd immunity can be established. This means that if enough people in a community have been vaccinated, it is highly unlikely for an outbreak of the virus to occur. Vaccines also reduce the risk of severe illness requiring hospitalization, which can help ease the burden on healthcare systems during epidemics and pandemics. In addition to preventing serious cases of COVID-19, taking a vaccine may also help protect you from getting other illnesses caused by different strains of coronaviruses, such as common colds. Some vaccines are even designed to provide protection against multiple strains of the virus all at once. When planning on taking a COVID-19 vaccine, it's important to be aware that most vaccines may require 2 doses given weeks apart. This is because it takes time for your body to build up immunity against the virus and for the vaccine to take effect. It's important to follow through with both doses of any vaccine in order to ensure that you are fully protected. In addition, if you do end up getting a cold or other illness after taking the vaccine, this does not mean that it didn't work. Vaccines don't completely eliminate your risk of catching illnesses, they just reduce it significantly, which means that some people may still get sick despite being vaccinated. If you do happen to catch COVID-19 after taking the vaccine, there is evidence that suggests that people who have been vaccinated will experience milder symptoms. You are still strongly encouraged to quarantine yourself and practice social distancing, but the risk of severe complications from COVID-19 should be reduced if you were vaccinated. It's important to remember that not everyone will experience the same effects when it comes to taking the vaccine. Some people may have mild side effects like soreness at the injection site, fatigue, or a low-grade fever. Other people might experience more serious side effects such as hives, difficulty breathing, or swelling of the face and throat. Although these are uncommon and generally short-lived, it's important to seek medical attention immediately if any of these symptoms appear after being vaccinated. Your healthcare provider can provide guidance on whether your symptoms indicate an allergic reaction to the vaccine, and if necessary, provide medical care. It's also important to note that the COVID-19 vaccines do not contain live virus particles, so it is impossible for you to develop an infection from them. Instead, the vaccine stimulates your body's own immune system to create antibodies that can protect against future infections. This means you will be less likely to get sick or need hospitalization if you are exposed to the virus in the future. In addition, taking a COVID-19 vaccine may reduce your risk of transmitting the virus to others. When your body develops immunity through vaccination, there is less chance of spreading infection when exposed. This can help limit transmission of the virus within communities and slow down the spread of COVID-19. It is important to remember that a COVID-19 vaccine does not protect you from all types of coronavirus infections and cannot guarantee absolute protection against symptomatic illness or severe disease, hospitalization, or death. Vaccines are designed to reduce the severity and frequency of symptoms, as well as lower risks for more dangerous outcomes associated with infection such as hospitalization and death. Therefore, even if you have been vaccinated, it is important to continue taking preventive measures like social distancing, wearing masks in public places, following good hygiene practices, and avoiding contact with people who are sick. You may experience mild side effects after getting a COVID-19 vaccine, such as feeling tired or a mild fever. These effects should go away in a few days and are typically much less severe than flu-like symptoms from the actual virus. It is important to note that even if you've been vaccinated, you may still be able to get COVID-19. Vaccines don't immediately provide full protection against the disease, but instead